Okay, we're going to talk through some of the abdominal arteries that you need to know for class. So because these are arterial, we're going to start with the aorta, and remember the aortic arch and the descending thoracic aorta, which is going to travel distally into the abdomen. It's actually going to pierce the diaphragm in an area called the aortic hiatus, which is a small opening just anterior to the spine where the aorta passes through the diaphragm. And our first major branch that comes off of the abdominal aorta is called the celiac trunk. And this has three vessels that branch off of it. The first one we're going to follow over to the right side of the body. And this is the common hepatic artery. And this artery is going to give off a few branches, one of which will be the right gastric artery. And it eventually becomes the hepatic proper artery. The hepatic proper artery is going to bifurcate into left and right hepatic arteries that are going to supply the liver with arterial blood. Now, if we follow this branch of the celiac trunk, this one is called the left gastric artery. We already had a right gastric artery. It was a branch off the common hepatic artery. And now this is our left gastric artery. And so they are both going to supply the stomach with arterial blood. Now our final branch off celiac trunk is going to travel all the way to the left side of the abdominal cavity, and it's going to supply the spleen with blood. And this is called the Splenic Artery. But along the way, it's also going to supply the pancreas and the stomach with blood as well. Now, if we travel just distal to the stomach, we're going to have our next major branch off of the abdominal aorta, and this is our superior mesenteric artery. And this artery is going to supply the small intestines and most of the large intestines with blood. Our next two branches are going to be the left and right renal arteries. And they're going to supply our kidneys with blood. So we're going to have a left and right kidney, as well as left and right adrenal glands that are perched right on top of those kidneys. So the adrenal glands need blood as well, which means that we're going to have a left and right suprarenal artery supplying them with arterial blood. Now, if we travel more distally along our abdominal aorta, we're going to send off two long branches that are going to travel distally into the pelvic cavity, and these are our gonadal arteries. So in males, they're called testicular arteries, and in females, they're ovarian arteries. And they're headed to either the ovary or the testes. Our final major branch off of the abdominal aorta is going to be the inferior mesenteric artery. And this branch is going to supply the distal end of the large intestines. So from transverse colon through the rectum. And then the abdominal aorta is going to ultimately bifurcate into the left and right common iliac arteries.